Have you or someone you care about stopped a birth control method because it changed their sexual life? You're not alone. Today we're unpacking why sexual side effects are one of the biggest reasons people discontinue contraception, and what can be done about it. Hi, welcome to Intima Wellness Lab, your safe place for holistic intimacy and wellness. In this video we'll explain the science behind sexual side effects, review the data on discontinuation, give practical strategies for users and providers, and end with clear next steps. This is an evidence-based, non-judgmental guide, whether you're exploring options for yourself or caring for patients. Section 1. What are sexual side effects? Sexual side effects include decreased desire or libido, reduced arousal, vaginal dryness, painful sexual intimacy, changes in orgasm, and emotional changes that affect sexual interest. They can be temporary or persistent, subtle or severe, and they're influenced by hormones, brain chemistry, physical symptoms, and relationship context. Section 2. How common are they and how do they drive discontinuation? For many women, sexual act is not just physical, it is emotional, relational, and tied to overall well-being. When intimacy suffers, quality of life suffers. Surveys and clinical studies show that sexual side effects are a leading cause of stopping contraception. Estimates vary by method: combined hormonal methods, certain progestin-only options, and some implants can be associated with libido changes. Even if a minority experience severe effects, the impact is large because sexual satisfaction is central to quality of life and relationships. Fear of side effects also drives people to stop preemptively. Section 3. Mechanisms. What's happening biologically? Hormones influence brain regions tied to desire and reward, as well as genital tissues. Estrogen not just influences ovulation but sexual functions by helping vaginal lubrication and tissue health. Progestins and systemic hormonal suppression can reduce circulating androgens or alter neurotransmitters such as dopamine and serotonin. Non-hormonal issues like device-related discomfort or inflammation also matter. Section 4. Real-world examples and patient-centered perspective. People report that what matters is not only measurable change but how it affects intimacy and identity. For some, small decreases in desire are manageable. For others, they're devastating. Clinicians should validate concerns and avoid minimizing sexual side effects. Section 5. Clinical and practical strategies. Communicate. Ask about sexual function at follow-ups. Use open questions. Patient-centered counseling helps to reduce emotional strain and improve intimacy even during adjustment and lowers discontinuation. Switch methods. Different hormones or delivery systems have different profiles. A switch can restore satisfaction. Try non-hormonal methods: copper IUD, condoms, diaphragms, effective and avoid hormonal impacts, fertility awareness methods. Adjunct therapies: vaginal moisturizers, local low-dose estrogen for dryness, lifestyle changes, and sexual therapy for relational factors. Timing and dosing. For some methods, lower dose or progestin-only options differ in effect. Mental health. Address depression, anxiety, and medications that contribute to sexual dysfunction. Lifestyle support, exercises, balanced nutrition, stress management, and sleep can help maintain sexual wellness. Section 6. When to seek specialist care. Refer to gynecology, sexual medicine, or pelvic floor therapy when pain, persistent dysfunction, or complex hormonal issues exist. If this resonates, please drop a brief comment. Did you experience sexual side effects with contraception? What helped? I read every respectful comment and may include anonymized stories in future episodes. Section 7. Balancing benefits and risks. They are vital tools for family planning and reproductive freedom. Contraceptives offer pregnancy prevention, cycle control, reducing cramps, and even sometimes prevent some certain type of cancers, health benefits. The goal is not to discourage use but to center bodily autonomy. Everyone deserves contraception that fits their life and sexual well-being. If you found this helpful, like the video, subscribe, and hit the bell to get notified about future evidence-based explainers. Share this with a friend or clinician. Check the pinned comment for sources and a resource list with studies and patient-centered guides. If you want a follow-up deep dive into specific methods and the evidence for each, let me know in the comments your biggest question about contraceptive and sexual health. We'll create a companion video. Thank you for watching Intima Wellness Lab, your safe place for holistic intimacy and wellness. Prioritize communication, seek care that listens to your concerns, and remember, sexual side effects matter. You deserve care that preserves your well-being and choices.